This woman had a facelift with eyelid surgery and a brow lift. But 80% of the result that you see is due to her fat grafting. That restored all the hollows and shadows in a very soft and natural way and gave her this friendly, open appearance. Afterwards, using her own fat, this is 4 months after, so there's not going to be much change for decades, we see a much more warm, soft appearance, much more consistent with her personality. One cannot really see the fat grafts unless before and after pictures are held up side by side as we see here. She had fat grafts to her temples, to her cheekbones a little, but more importantly, the hollows in front of her cheekbones and beneath her cheekbones. She had fat grafting to quite a number of areas around the chin and beneath the lower lip. All of these added to a very soft, natural look. Fat grafts are mostly placed deep, so they don't interfere with expression. All of her facial expressions are exactly the same as they were before surgery. Notice that she has one side of her cheek more wide than the other. I see this all the time, and we don't try to change that. We just put in the right proportions of fat on the two sides. This woman underwent facelift with brow lift, but clearly it's an example again of the most profound changes occurring with fat grafting to quite a number of areas around her face, probably 20 some areas on each side of her face. But these are careful, mostly small amounts based on my experience in over 15 years. She had considerable sinking in or hollowing or thinning of the tissues, and this quite severe hollowing of the temples was filled with her own fat. Areas beneath her eyes and the submalar, the cheek sinking in, was softened with fat. Around her mouth, we see a type of aging where the muscles have not weakened, the muscles have kept all their strength, but the soft tissues have thinned, and the very delicate balance between the overlying skin and soft tissues and the muscles is offset over time, and we can see the consequence of such relatively stronger muscles on the soft tissues, not only sinking in, but causing creases due to the power of these muscles. Yes, Botox can be used, but with fat grafting, a far superior result can be obtained. Soft tissue thickness is restored with her own fat. Very small injections with a micro cannula around her lips. The very tiny wrinkles were addressed with a small needle injecting fat just beneath the skin. I would have preferred to do laser resurfacing, but she lived many hours away and the recovery is a little longer with that type of thing, and she wanted to head back. We've added augmentation to her lips and we restored volume around the mouth, in front of the jowl, and to the chin itself. Like with all my facelifts and facial rejuvenation surgery, this woman's surgery began with harvesting of fat from agreed on areas. This was done with a syringe technique and the fat processed in the operating room by our technicians. These are judicious amounts based on my experience. Everything is meant to underdo rather than overdo, since the amount of improvement even underdoing is so great compared to not doing it at all. She ended up having a small chin all her life, and we decided on chin augmentation as well, and that's another thing we use the fat for. She could have had fillers, falling surgery, every 5 or 6 months, although there are some types of fillers that last even 2 years. But the costs over time would be much greater. And in certain areas, fillers, although wonderful, probably could not have given such a natural result. The pictures I've shown before of her and the other patient have been shadow pictures, which are much more revealing of what we see every day in most of our pictures that we take. Most of the time we're not using a flash. This is a flash view, but it's nice to look at contours as well. Also, we better see the scars around her ears. There's one under her sideburn, and if you look really carefully, you can see the other facelift scars that she had. Again, most of her improvement wasn't with the facelift, it was with the fat grafting. From the side, we can see that she's had a brow lift. Notice her brow is nicely and subtly raised. Let's look more carefully at her profile view around her chin. We can see volume restored. Actually, she looks like she had a chin implant, but this was done with fat. I don't do as many chin implants as I used to since fat works so well. And in many cases, fat works much better since there's complete freedom about where the fat is placed. It could be placed in many areas where the chin implant could not go, especially up closer to the lower lip. We see quite dramatic changes to the lower lip and chin area from fat grafting. But let's look at the more subtle but still very important improvements to her upper lip. Clearly the red lip has more volume to it. But in the before picture, notice that the upper lip is straight up and down. There's no pout to it at all. I added fat to the white upper lip to add volume to that, since that had loss of soft tissue over time as well. In the after picture, we see a very slight pouting of the upper lip. The direction of the visual border of the white upper lip is no longer straight down, but a more softer, youthful orientation. So how does a surgeon become proficient at fat grafting when there's really not much experience in training in residency? You can't really learn it in a course or reading a book. For 15 years, I've used the same approach, gathering experience, starting out small, with absolute meticulous record keeping. I record before surgery exactly what I'm going to place and where, and then during surgery, I have a dedicated staff member who records to the 10th of a cc exactly what I place and where. Just as key is reviewing results. When patients come back at 4 or 5 months, I know the result is not going to change much for decades after that. And that evening, I go through exactly what has been injected and where, and the before and after pictures. This is invaluable. I guess it takes the right type of personality to have this persistent diligence and patience over time. Well, 2 types of patience to gather the skills necessary. Overall, after years, I see there's 2 parts to proficiency. About 75% is judgment, and just 25% are the technical skills to inject it. I must say, I have to give credit to my experienced staff that's been with me for years. They understand how important it is to be extremely meticulous, and they value our experience over time and all the steps that are necessary. For example, details would never cross your mind, such as if you harvest some fat from the hip roll and some other fat from the abdomen, those syringes must be kept separate, because if you're injecting the right and the left side of the face, you must use the exact same origin of fat in each, or there may be some slight difference in survival or texture or appearance over time. When done right, one can see why fat grafting is one of the most profound advancements in plastic surgery in the past 20 years. I hope this was helpful.